is Choma, your NCLEX Prep Coach. I am the founder of Choosing Nursing. Over at choosingnursing.net, we help you to pass your NCLEX exam. I am a registered nurse. I'm an NCLEX Prep Coach. I graduated from San Diego State University with my Bachelor's of Science in Nursing degree in May 2010. So I've been a nurse now for officially 8 years. After that, I practiced 4 years of med-surg and tele-nursing, and then I did about 1 year of insurance nursing, and then now I've been helping people to pass their exam for about, I would say, 3 years this month. And I really have a heart towards helping to equip, teach, and train people and educate people all over the world as far as what they need to know in order to really understand nursing. I recently was on a podcast interview actually, and it just reminded me of the experience of going through nursing and how it really is like learning a brand new language, because there's a lot of information that you got to know, right? And it's a different way to learn information too. So I understand the challenge of that because I've been through, when I went through nursing school, I didn't pass one of my classes. I actually failed. I had to retake a class. So I understand what it feels like to fail, and the challenge of that, and I'm getting back into the groove again to do things all over again. So what I do is help people to pass their NCLEX exam. And we've had such great testimonials of just so many people passing their exam that have failed before, people who have taken it multiple times and then passed after receiving our help, people who are in international countries, and were struggling, and now we're able to pass. So it's truly a joy and an honor and a pleasure to be able to serve and help people in this dimension. So if you're watching this for the first time, I am so honored. I'm humbled. Thank you so much for watching. If you're not following me, I would encourage you to follow right now. I promise you, I give you information that's gonna, make things begin to connect and help you to see the picture. So you can follow me also over on Instagram, which is choosing_nursing. So if you are more of an IG person, go ahead and follow me on there. And you can follow me over on YouTube. I'm not on YouTube live right now, but you can definitely follow me on YouTube. So Choosing Nursing on YouTube, and we put out different videos on YouTube every Tuesday now. And then also as well, one more place, you can follow me over on Pinterest, over at also as well Choosing Nursing. So those are all the platforms where you're gonna find me as far as teaching you to prepare and pass your exams so you can become a licensed nurse and go on to fulfill your nursing career. So today we're going to be talking about how to interpret EKGs. Where I'm going to talk to you about how to interpret EKGs, at least within the time frame that we have. All right, so did you know that EKGs is covered on both the RN exam as well as the LPN exam, both tests? If you go to the website, it's called ncsbn.org, right, which is the National Council of State Boards of Nursing. And so I check on that website regularly as much as I can. And if you go to that website, you'll see they have a detailed test plan. What that is pretty much not like, how they'll put includes but not limited to. So it will provide you with a full breakdown of a lot of the information that they will cover on both the RN test and the LPN test, and one of them is EKGs, and it's actually under reduction risk potential category, which covers about 12% of the exam. So you're looking at, that's like the fourth highest category, more so or less, when it comes to the test. So you got to know how to read it for the test, and you got to know how to read it clinically, because honestly, especially when you work night shift, right? When you work night shift, there will be times where, the rhythm can change and patients can change on you like that. So you need to be able to identify that, early, because night shift, that, there's more problems that can occur that people don't realize, night shift. I used to work night shift. So I did both day shift and night shift. All right. So There's 7 main steps when it comes to learning EKGs. All right, there's 7 main steps to learn EKGs. Of course, like, there's multiple mini steps within that, but there's 7 main things to kind of give you like an overview as far as what route to take. Because one of the problems a lot of people have is that you don't know what steps to learn the information in. And that's why it seems confusing or difficult or challenging. So I'm going to kind of help guide you, in that manner. All right, whether or not you move forward with other things. So let me go ahead and break down all 7 steps. So you want to begin by learning the electrical conduction system. So here's the thing. The reason why a lot of people don't understand the rhythm and everything is because they don't understand what's causing the rhythm. So this is what I'm going to break down. I'm going to explain to you what is the electrical conduction system, right? And really helping you to understand, what that means. So the first thing is that we got to learn that, and that's what I'm going to go over in this teaching. Step number 2 is that you now want to learn sinus rhythms. Okay, so now you want to learn sinus rhythms. Okay, so sinus rhythms. So the electrical conduction system is pretty much how electrical activity moves throughout the heart. Okay, and I'll break it down for you in a minute. Step number 2, you want to learn sinus rhythms, which is going to be, of course, normal sinus rhythm, sinus arrhythmia, also known as sinus dysrhythmia, right? Sinus bradycardia, sinus tachycardia. That's what I mean by sinus rhythms, right? Because we're trying to first learn more of the normal stuff before we get into the abnormal stuff. That makes it easier to retain the information. The third step is that now you want to learn junctional rhythms. All right, so step number 3 is learn junctional rhythms. Okay, step number 4, now you want to learn atrial rhythms. Okay, so atrial rhythms, these are like atrial fibrillation, atrial flutter. So now you're learning, okay, like more rhythms that are abnormal because of what's going on with the atrium. Okay, step 5, now you want to learn ventricular rhythms. All right, learn ventricular rhythms. So this is now, like VFib, VTAC, right? SVT, right? These are the ventricular rhythms that we want to learn now, right? So once again, I'm just trying to walk you through, piece by piece when it comes to the rhythm. Then step number 6, now you want to learn heart blocks, okay? Heart blocks. So what is first degree heart block? What is second degree? The 2 types, Mobitz 1 and Mobitz 2. What is third degree? Complete heart block. Right? So now we're learning the different types of heart blocks. Okay? So, and there's other smaller rhythms like that are not as common, such as torsades de points, PEA, right? Like a pulseless rhythm. ST depression, ST elevation. There's also there are also specific abnormalities that are based on one segment of the rhythm, which is going to be like ST segment elevation, ST segment depression, QT prolongation, right? So those are based on specific segments of the rhythm, okay? So just breaking it down, right? Then once you get through that, you want to practice, 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 okay? Practice, practice, practice. So one more time, step 1, learn electrical conduction system. 2, learn sinus rhythms. 3, learn junctional rhythms. 4, learn atrial rhythms. 5, learn ventricular rhythms. 6, learn your heart blocks, right? And then 7, practice, practice, practice. So here's the thing. One thing I realized for a lot of people that people may not be aware of is that everybody has a different learning curve. So what I mean by this is that some people, after I go through today's teaching, they'll hear it, oh my gosh, I got it now. Like, this makes so much sense. okay, now I just need to go and just, go over a little bit more and now be, in a little more detail. But now she gave me the overview, right? So that's one type of person. Another type of person is like, okay, you know what? It's starting to click. Now it's starting to make sense, but it still hasn't completely connected the dots for them. So they may need to look at more visuals. They may need to go through more visuals before they get what I'm telling them. Like some people are more visual learners, right? Where you can say everything, but then it's not until they see the picture where, okay, now I got it. Or some people some people just have a longer learning curve. So what I want to encourage you, never ever feel discouraged, right? Because of how long it's taking you, because it just means that you have a different learning curve. So you need to identify that early so that way you don't get frustrated, and so now okay, I need to change how I learn information so I learn it faster. Okay? So that's why some people, when I go over the teachings, even any live broadcasts, I'll explain it, but then some people are like, oh my gosh, like, oh, I got it. But then other people are like, okay, I heard it, I wrote all the notes, but I need to read it again though, right? So just bear that in mind.